What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how to deal with pediatric patients as an X-ray tech. For those who do not know, pediatric means little kids in sense. Depending on where you work, it could range from 5 and under, 8 and under. They consider pediatric. Some of them, if they're below 18, but technically when you hear pediatrics, this is little people, little kids for the most part. That's what you consider. I consider pediatrics also. So to give you context, I work trauma 3 ER, night shift. So I would say you will get a mix. Even me being a dad, it helps if you're a parent. It will add a little bit of an advantage compared to someone who doesn't have kids. I will say that off the rip, because anytime there's a kid and my partner that I work with doesn't have kids, so it's like easier for me to go in dad mode and kind of shimmy the situation or calm the kid. Obviously, me being a parent, I know for a fact that I'm just a random person to this kid, and they get scared, especially like for certain ones. If like the mom's pregnant, or if the parents are afraid of radiation or concerned, they'll like step out, and then it's just you and the kid. Especially if you're alone, it makes it a little bit more challenging because you might have to let up and hold the patient to get the exams. And other ones are like little walkie-talkies. They'll just sit there and you're like, "So," and then just do the exam, which those are the golden nuggets. So you might have to talk to them different, and of course, whenever you're exposing them, make sure that it's a PD technique, because occasionally people are in a rush and don't see that, and then they expose them and you most likely burn the picture. Like the picture will be black, so keep that in mind. Similar, most commonly you'll do like a chest x-ray because they swallowed like a coin or something, or their tummy, like they haven't pooped, they're constipated, so you'll do like a KUB, or you'll do a babygram, which is a chest and a KUB. So that's usually the kind of spiel you do with babies. And then of course, if they fall and hit their arms or something, you'll do like your little hands and stuff, which unless he just chilling there, you're most likely gonna have to hold, or the parent will have to hold the hand, and there might be like your finger on top of his finger because they're looking at this, and the baby won't hold it. Like there's exposure and stuff to that. So that's something to keep in mind. And then sometimes it might take you and the parent, especially if it's like a mom in there and you're trying to get a lateral chest and the baby's like squirming. It might take the mom holding him, and then you at the bottom trying to try to get less motion on the picture. So that's something that will happen. If you had to ask me, would you rather have mom or dad in the room, I would take my money on dad, because usually dad, it's like, all right, let's get this picture straight down to business. They're just like, hold them and like, eh. And then mom's more like emotional most of the time. They're like, oh, my baby, don't worry, dad. Like type. I mean, it's what you see on average. So that's usually what happens. And most of the time, by the time you get there as a tech, the nurse has either sticked them up their nose or drawn blood, so they're already like hollering and screaming, and like you come in with big machine or you take them somewhere, they think you're gonna hurt them too. So it's kind of like, they don't understand that. So. But it is nice. Certain little kids, older ones will be mind blown by the technology, and it's sometimes rewarding. So yeah, it's been your boy Miguel. See you on the next one.